but they need to be working together because we know that people are more than a sum of their parts, but yet we're working even in these like vitalistic fields in these like silos. That is the foundation of everything I do. From the beginning, I've been practicing almost 16 years. And at this point, I have clinical practice. I've actually trained and certified doctors, almost 200 doctors in 6 countries, all over the world. And they're doing this approach, which this approach is bringing together, the nervous system and chiropractic, neuroeducation, brain and body movements, primitive reflexes, eye movements, cognitive games, biomedical work, like all of this stuff together to say, what's going on with this kid or adult in front of me that even if we've addressed, let's say, a chronic infection, or we've gotten the autoimmunity or inflammatory cascade under control, now we're left with a brain that had deflected processing and development as a result of that. Now what do we do?
This is the Auto Community Podcast. All interviews presented on the Auto Community Podcast are designed to provide information and inspiration only. Guests of the podcast may present opinions and anecdotes that are solely their own. And as always, before beginning any treatment protocol, consult with your preferred medical provider. Hey everyone, welcome to the Auto Community Podcast. Today's guest is Dr. Amy Spoelstra. Amy and I have met, I don't even know when we met. Quite a while ago. Amy is a chiropractor by trade, but she also has done something quite unique with her profession. And I'm excited to have her tell you all about that. So welcome, Amy. Thanks for coming on.
Thank you. Thank you. Great to see you and be a part of your community.
So tell us a little bit about, obviously you're a chiropractor. Obviously, I would assume that means adjusting spines, but I know that your journey has been a little bit different. So tell me a little bit about what it is that you're doing now.
Yes, my journey is different, has been different. So I think it kind of starts with just how I got into chiropractic, and then we can kind of lay the foundation of understanding of the clinical approach and how we're helping people now and what we do now. And so I was raised, if some of your listeners out there, if you know chiropractors, and I bet you do know some chiropractors, a lot of chiropractors kind of grow up in chiropractic families, right? So they're like kids of chiropractors. They're like all their aunts and uncles are chiropractors, and they grow up in this worldview of, not what some people and some of you might be thinking chiropractic is, which is like, kind of a lot of people think chiropractic is about just back pain and muscle spasm and that kind of stuff. But really the foundation of what it really is about the nervous system, because what we know, just like the skull protects the brain, the spine protects the spinal cord, and therefore the communication between the brain and the body is really important when it comes to making sure the spine is aligned properly and moving properly. And, the cool thing about just that is that that's really the foundation and the creation story of chiropractic, is looking at the nervous system and the communication and function within the nervous system, brain and body. And now the neuroscience, like all this massive emerging research that's happening in the neuroscience fields is really making the case for like, hey, we have to look at the communication and the function within the nervous system first. And so when I talk about a lot of chiropractors are born in chiropractic families, they're really exposed to that worldview and that way of looking at health in this kind of vitalistic hold apart, I like to call it, way from an early age of like, hey, the body has this innate intelligence within it that's made to heal. It's a self-healing, machine. And this communication system within the body, brain to body, that's nervous system, is really important to keep it clear and communicating. And that's like the chiropractic message and understanding. But I was not raised in that. I was not raised with that understanding or that worldview or in the profession at all. But I was raised first of all, with a brother with behavioral learning and emotional regulation challenges and sensory challenges and gut challenges. And when we look back, there was probably had PANS, like really, there's a lot more going on with the information we know now when we look back at his history. But my dad was an optometrist and my mom was a school teacher. And for some reason in our kind of standard American family, they were like, there's more to this story. We don't just want to medicate him. We don't just want to like cover his symptoms. We want to understand them. We want to look for underlying solutions to how to help this child, my brother. And so my dad became specialized in his field and he became a neuro-optometrist. Now, those guys are kind of weird too, because they have a few different names. So you may have heard of like behavioral optometrists or developmental optometrists or neuro-optometrists. That's kind of like all the same thing. And what they're doing is they're more specialized, kind of like you could go to a chiropractor for like back pain, or you could go to a chiropractor who says, hey, that back pain is telling us a little more about the whole system of your body. And maybe we should look at that nervous system and the structure of your spine, communication in your brain and your body. So it's a little more specified and specific, and that's like within chiropractic. Optometry is kind of the same way, where we have like an optometrist, which most people think of, they go and they tell you like, do you have 20/20 vision? Do you need lenses? Like, what's your acuity like? And then there's this specialized field within that profession, which is these neuro-developmental behavioral optometrists, which are saying, not only is acuity important, like, can you see? But also how you move your eyes is important. And, if there's alterations in how you move your eyes and it changes your visual perception and it gives us windows into the brain. And that's really important when we look at traumatic brain injuries, when we look at chronic stress response, which is big with like autoimmunity, inflammation, when we look at behavioral learning, socialization. So I grew up in that field, like going, hey, these things are pretty important and they tell us a lot about the brain. And I grew up with this really deep understanding at a really inappropriately young age about neurology and clinical application of that and all this stuff. And then I became a chiropractor. And so when I started studying to be a chiropractor in chiropractic school after my undergraduate, I started realizing that these professions, as well as education, as well as nutrition and kind of the biomedical approach. Like I had kind of a lot of influence from all of these different fields because of my unique life and clinical experience, educational experience, but none of them were talking. And I was like, well, they all have like this really amazing and important contribution, but they need to be working together because we know that people are more than a sum of their parts, but yet we're working even in these like vitalistic fields in these like silos. And so that is the foundation of everything I do. From the beginning, I've been practicing almost 16 years. And at this point, I have clinical practice. I've actually trained and certified doctors, almost 200 doctors in 6 countries, all over the world. And they're doing this approach, which this approach is bringing together, the nervous system and chiropractic, neuroeducation, brain and body movements, primitive reflexes, eye movements, cognitive games, biomedical work, like all of this stuff together to say, what's going on with this kid or adult in front of me that, even if we've addressed, let's say, a chronic infection, or we've gotten the autoimmunity or inflammatory cascade under control, now we're left with a brain that had deflected processing and development as a result of that. Now, what do we do? How do we put these pieces together? And that's what I do. And so we've been doing that. I've been doing that in my clinical practice. And now like I said, we train that. And so we have doctors doing this work around the world. And also we have founded a branch of what we call the Focus Academy, which is where I train and certify, that we're doing clinical research. And we published a paper this year. We're publishing more this next year. And we're really excited because, unfortunately, as this community probably knows, there's just a massive amount of individuals now, kids and adults, that are really living a suboptimal life because of, stressors that are impacting our neurology, impacting the way that we can live our lives and impacting the way that we engage and connect and live in our worlds. And we really, one of the things that I understand too, being a parent and a provider and dealing with these things myself and in my family, is it's so frustrating when you are like, there's more than one piece to this puzzle. And why is nobody putting the whole puzzle together? And you go to provider and provider and provider, and they know like this much. And because they don't even know about the other things that are out there, they don't know how to play with the other parts of the team. And they don't know how to recognize when somebody might need, sometimes in addition to what they're doing, might need some of these other pieces. And they can still just do what they do and do it well, but they have to, I always say, providers have to know more, not always do more. So
yeah.
I do.
Absolutely. I think that's so important. So often, we feel as patients, as someone who's struggled with autoimmune disease myself and then dealing with providers for my son, I think every single time I went to a doctor or some kind of provider, people would say, well, did you like your experience? Well, yeah, but like there was never one doctor that got everything right. It was always like, well, yeah, this doctor helped us with this, and so then we have to piecemeal together all of these kinds
Yep.
of treatments in order to realize more holistic, whole with a W, holistic kind of
Yeah.
healing. And so, yeah, I think that's very, very important. And I love how you're integrating all of those different pieces and parts. So, what kinds of people are you working with primarily?
So my real passion has always been pediatrics because if we can, well, for multiple reasons, but one, from a clinical perspective, if we can identify what we call neuro-deflective tendencies or neuro-deflective profile of a child when they're younger, right? When they're still developing. So like under 20, and of course we're still developing past that, but like even under 10, under 5, like under 10, like my bread and butter is like the 9-year-old, the 10-year-old who the parents are like, yeah, well, we started having these challenges and we've been doing all the things and we still haven't gotten to the foundation. Nobody's really helped us. My kid's been labeled as bad or, parenting bad or whatever, not trying hard enough, but nobody's ever really gotten to what's going on here with behavioral learning or socialization challenges, or the 9 or 10-year-old who seem to be developing on, they're kind of hitting milestones, give or take, and they're doing pretty well. And then all of the sudden they have a learning challenge, or all of the sudden they have anxiety, or these types of things. That's like my favorite. That's my absolute favorite age group and presentation to work with. And, we work with a lot of younger kids and that's wonderful. But sometimes with the younger kids, even though as providers, we know like if we can get them younger and we can get that kind of early intervention concept like sooner, we're going to have better results faster and we can avoid a lot of the challenges. But in my clinical practice, what I found is that the majority of people that come, families that come, they kind of need to experience and kind of go on their journey of trying to do a lot of the traditional things and like, work in these silos before they start to have this awareness of like, okay, why is nobody actually looking at the root cause of what's going on with my kid? And why is everybody just trying to cover the symptoms? And why is nobody talking together? And then when they come to us, they're like ready to develop their brain-based lens and learn, and we can like have a really great working relationship. Not to say that some parents aren't there when when they first spot a challenge at 3, or, or the kid won't do tummy time, in their first year. And they're like, there's something going on here. They miss crawling. But my passion in pediatrics is that if we can course correct at a younger age, we can avoid a lot of the challenges. We can get faster results. We can work with families to get, better connection and make bigger lifelong changes at the younger that we work with kids. Now, I also work with adults. I've worked with people in their 70s that are, that have had struggles their whole life, or that had just, started to experience struggles, in their later life with concentration or memory or stress adaptability and that kind of stuff. But my favorite is peds.
So, walk me through what an appointment looks like for somebody just walking in your door. I know you use a lot of different approaches to each individual case, but what might a typical appointment look like?
Well, initial assessment. So we have kind of these different phases of care. And the first phase, I always say, is this is like our most fun as the doctors that we work with. I say, this is, don't miss this. So many doctors like miss this piece. I'm like, this is where you get to be an investigator and you have to know more about development, which is what we teach our doctors. Like you have to know more so you know what to look for so you don't miss things, right? But we have to do a really kind of deep dive in developmental, neurological, history, and we need to be able to assess appropriately through asking questions, through paperwork and asking questions of the parents. We need to be able to look at, are there signs of inflammation? Are there signs of autonomic dysregulation? What was happening preconception with both parents, if we have that history? What was happening in utero? What was labor and delivery like? What were milestones like? And then asking questions beyond milestones. Like, that's really, really important. It's not just if a kid hit a milestone that tells us about their developmental history, which tells us about the architecture of their developing brain, which gives us a lot of clues as to why they might be having certain challenges now. But we have to be able to, ask these questions. And so in our office, what we do and what I train other doctors that offer what we call the Brain Blossom program once they're trained to do is we do all of that with like this. We do it in telehealth so that the parent doesn't have to find a babysitter or figure out alternative options. We make it available either way, but we prefer to do it this way. And we always do it, if at all possible, which 99.9% of the time it is, without the child present. This is key. And this is something that, Erin, as a parent, like, you go to these providers who specialize in working with kids, and then they want you to sit there and talk about all the deficits that your kid has and their challenges in front of your kid.
Right.
And it's like, that's ludicrous. And so we don't do that. And that's really important. And so we usually do it this way. We gather that information, and then we go into the second stage, which is going, okay, so I've started to inform my clinical understanding of what might be going on with this patient. And now we're going into the exam process. Our two main objectives in our exam process. First of all, we use a lot of brain-based kind of concepts to reduce avoidance and stress and things for the kids. So often parents will say, like, well, they're not going to come in and they're not going to perform the exam in the exact way you want them to. And, we've had this problem with other providers, and we're like, don't worry about it. Don't worry. A lot of our exam can be done through observation and play. It may look, like it's not a typical exam, or it might be perfect. Like, it's okay. It might have to be broken up over multiple times. It's okay. And we have some very specific things that we do that tend to really work. And parents are like, wow, I didn't expect that to go that way. And we're like, yeah, this is what we do. Right. And so on our clinical exam, our two objectives, our two big questions, this is what we say. We're looking for two big questions. And one is, we're looking for objective indicators of altered neurological function. What's the state of the nervous system, right? Do we have more of that sympathetic, that fight or flight? Do we have good balance between the two branches, the two big branches of the autonomic nervous system, that parasympathetic and sympathetic? Are we low tone? Are we high tone? Like, what's going on there? And so we have some objective measures we do. We do a pupil assessment. That gives us a lot of information based on how the pupil responds to light, releases after light is there, about the autonomic nervous system, about that fight or flight and rest and recovery. So we look at that. We look at heart rate variability. We look at thermography. We look at surface electromyography. We're looking at tone of the muscles. So we're getting all this information to inform us on, hey, are there indicators of altered input to the brain and the nervous system, which will alter processing of information and integration of information, and then, of course, output from the brain. If we have altered input, it alters function and growth, which alters output. So we have to look for that. We don't get to guess. We don't guess, we measure. And so that's our first clinical question. And so, that's all those things I just mentioned, those are our like gold standard. And we might get that from quickly playing on the floor with a kid in the waiting room and shining a light in their eyes, or seeing how they react and watching them. Or we might be able to go into our clinical exam room and actually go through all those exams and get them perfectly done. Either way, not a problem. The second big question on our exam is we have to look at, we're looking for altered input, processing, output. And then we want to look at, and how is this child using their brain? Right? What tools are their primary tools that they're using? And what does that tell us about the architecture of their brain as it's being developed, or in an adult as it was developed? What does it tell us about the primary tools they're using? What does that tell us about which areas of their brain they may be engaging in more or less? And this is where we do what we call our functional brain-based exam. Again, this can be done via play, observation, or in the clinical exam room, or a mixture of both. So this is where we look at primitive reflexes, This is where we test gross motor function, fine motor function. We look at auditory verbal. So how are we doing with receptive expressive language? How are we doing with, if we play a metronome, how do we time, a clap to that or a stomp to that? Or, there's different ways that we test that, which some are available for the kids that we work with and some aren't. No problem. We're gathering information. This is where we look at eye movements. We look at convergence and divergence and tracking. Can we predictably and accurately point our eyes at things to have an appropriate perception of our visual space and our body in space? We do some executive function and visual cognitive testing. We have some technology, the right eye technology we use to actually look at the eye movements, and we do a bedside assessment. Again, sometimes we do both. Sometimes we do one. Same with our pupil response. We have some technology that actually measures and diagnoses what's going on with the pupils. And sometimes we just do a quick little look ourselves. It just depends. So then our doctors take all of that information from our investigative, review, and then from our exam, and we go, all right, what's going on here? Right? Are there indicators that we might need to get, more biomedical support on right away? Do we need to do that later? Does it something that's already been addressed, but maybe not at the right time? So we need to get it back on. Is there indicators of an infection, of potential chemical stressors, emotional stressors, physical stressors? And then what were the consequences of that? Then we put together our clinical plan. And all that information informs us on what the best clinical tools, chiropractic, brain and body exercises, the neuro rehab piece, brain-based parenting and mentoring, altering educational demand potentially, nutrition, biomed, these types of things. That's where we say, okay, we need to get some other of our provider friends on board as well, collaboratively, or we need to start with this and reassess and bring them on later. We put together a big picture plan based on what this person needs.
Yeah, I think that's really important because one of my questions for you was about timing. A lot of times when I see kids, they might be in this hyperinflamed state. And so my goal as a homeopath would be, okay, how do we decrease the inflammation? How do we give the parent a rescue kind of a remedy in the moment, when they're in that hyperinflammatory state? So I do think that's really important. So what would you say to a parent who brings in a child who perhaps has a pretty severe PANS case, and they're just really hyperinflamed? Would that be a time to take a step back and choose something else prior to starting care with you?
Yeah, timing is really critical. And that's where the knowing more, which gets a lot of providers in trouble because they think, well, my step has to be the first step. And then they might not even know the other things or know what to look for to recognize. Like I teach our doctors, look, you're not going to be the expert in PANS, PANDAS, like all this stuff. You don't have to be. You need to be the expert in what you do, but you do need to know about it so you can see it when it's coming in. So then you can go, okay, what do I do here? So like in that situation, if I have somebody who's in like this acute flare, then we need to make sure that we are lowering demand, right? We need to lower demand in all of the different ways that we can, clinically, educationally, socially, in all of these different ways, while we are then saying, okay, this is where I break it up into like clinical long-term strategies and right now solutions, right? We need both. And that's where we kind of falter, is sometimes we like neglect one or the other. Holistic people will sometimes neglect the right now strategies. Like you have this family, like you just described, coming in, like they need some support right now. Right. And we can't make them wrong or feel bad or say that, well, you got to pick one or the other. That's not the case. We need both. Right. And those right now strategies sometimes come in the form of interventions, even pharmaceuticals. Sometimes if a kid is in an absolute flare, sometimes they might need something to just like bring that fire down a little bit so that they're safe. Right. And so that's where you need, like me as a provider, I'd go, okay, is this child, is this family safe? Do we need to get one of our other providers who has those tools for some of those right now strategies on board right now? And I would say, like from the tools that we use, I would be giving some brain-based supports, like some really practical, like here, try this strategy as far as like connection and safety and like really practical, like talk to your kid this way, don't talk to them this way, do this thing at school right now because they're in a flare. I would get some of our other providers on board that could provide the appropriate biomedical or pharmaceutical, whatever needed to happen in that moment to keep everybody safe. And I would say, if we can, we definitely would want to be adjusting that child, but adjusting with probably some different techniques and probably in a different way. And maybe in a different way, even in the office, or maybe not even in the office, just to calm and bring balance to the nervous system. And I would probably be bringing some eye movements on board as well. And we've had that exact scenario many times in our practice, of course.
Right.
And so that's where the knowing more and having knowledge in clinical long-term solutions and right now strategies, and being able to have the depth of knowledge to see what's going on, to be able to navigate that is really important. And I will say, even within my own profession, chiropractic, that's a big piece that's missing, because providers think like, if I spend any time learning about these other things, then I'm going away from my philosophy or what chiropractic or whatever. And it's like, no, you need to know more. You're working with kids that are going to be presenting in these ways. And we absolutely have a foundational role in helping them heal. But like in that case, I would not be bringing in big brain and body exercise, neuro rehab, neuro-deflective retraining at that moment, because that's adding a demand that that child is not ready for at that moment.
Right.
They may be ready in a month. They may be ready in a week. They may be ready tomorrow, or they may be ready in a year, but we have to be able to recognize when that is.
Yeah, I think that's really important. I know early on in treatment with my own child, we tried a form of neurofeedback that was very interactive. And unfortunately, it actually caused worsening of symptoms, primarily because it was adding to that load. It was adding to the demand, trying to force him to do something that his brain just wasn't able to do in that moment because of all the inflammation. So that's hugely important. So I appreciate your approach there.
Well, and the neurofeedback specifically is more of a top-down approach. And so like when, the way it can be really good and really beneficial, but when we have an individual who has bottom-up challenges, basic autonomic nervous system regulation challenges, and other stressors on board from inflammation, autoimmunity, a current flare, you don't want to be going top-down, because can be, even if like temporarily you see an improvement of symptoms, you can actually be creating a much bigger challenge that might pop out in other areas. Like I'll see it all the time where they go, well, my child's reading improved, but it's weird. They developed anxiety. Okay. Well, those are all connected, and we have to be able to know like, what's happening with the whole child, as opposed to just like, again, shifting into that deficit mode, and knowing more allows us to know when things would be appropriate.
Yeah. So something, I think you touched on it a little bit, but something that I think a lot of people, perhaps providers, don't readily talk about is some of the anger and aggression. And I think it's really important to address a lot of these behaviors, I think, stem from dysregulation, obviously in the nervous system, as well as in the brain. And so if you had a child who was presenting with some of these more extreme anger, aggressive type behaviors, and they're not safe for themselves or people around them, how might you approach that? And would it be any different than any other child who presented, say, with more anxious type symptoms?
Well, that is really common. And I see that with a lot of patients that I work with. Absolutely. And the first step is like, is this family safe? And I think that, yes, it is hard nobody wants to talk about that. Nobody wants to really understand the depths of that. And it is important. And it's important for providers that are working with, like I always say, like, listen, if you're working with kids in your practice, you are working with kids with behavioral learning and socialization, neurodevelopmental challenges. You just might not know it. With the statistics now and the amount of, stressors and how that's impacting the brain and the brain of our developing children, you're seeing them. Therefore, you have a responsibility to understand what that looks like, how to spot that, even when it's subtle. And you need to understand more about the life that some of these families are living, because that is like one of those things. That's why we have like, Amy Yardley, she's both of our friends. And she teaches in some of our curriculum in the Focus Academy, because she shares about the parent perspective and life. And I don't do that to like scare doctors, but I want them to really understand, because the first piece that you said there was like, if you have a family that's like, you're having emotional regulation, anger, aggression, sometimes that can look like a hole in the wall. And sometimes that can look like this family's not physically safe. And that is a very scary, for many reasons, reality that a lot of families are living with, and that they also are afraid to share, because one, they don't know, like, okay, so what do I do about this? And two, they think, if I say this and I ask for help, is my child going to be like taken away? Is my, like, who's there that's actually going to support, but understand, and not just say like, my kid's bad or I'm bad, but there's actually something neurologically going on here with this child. So I think you and I are both on the same page of just like outing that a little bit and saying, hey, this is real. And this doesn't mean bad kid, bad parent. This means like, this is an emergency. Like, the first thing we need to do is make sure, it's like when somebody's having a mental health crisis, which is really what this is. Are they safe? If they're not safe, okay, do they need respite? Like, are there services for that in the community? Like, know those things, right? Like, as best as we can, like, check in with them, like, what's happening. So I just think that that's an important thing to just say, because that's my first thought, right? And then from a clinical perspective of understanding, okay, so if this isn't just a bad kid, what does this tell us? If I see somebody that's having, like, which we often do, rage, emotional dysregulation, like, in this way, that's a window to me that they are massively out of balance in their nervous system, and they are massively active in their brainstem. They certainly will see clinical presentation of that in the form of overactive brainstem, decrease in frontal lobe, decreased top-down inhibition. You cannot then engage with this family, because if you have a child in that state, guess who's also in that state? Because they're in survival. Mom and dad, family, caregivers, everybody's in that state. We don't then go with long-term goals, talking about long-term solutions, logic, tons of information. We go with like, okay, so we might look at the long-term goals, but we also need to then go, okay, how do I give this parent and this child some right now strategies, and give them like, okay, I'm going to see you tomorrow at this time, and we're going to do this. And then the next time we're going to see you tomorrow. Hey, we've got a long-term plan, but right now, Erin, I just want you to think about, I'm going to see you on Tuesday. And we understand that that child's more active in their brainstem. We understand that we're going to see eye movement errors, and we're going to see primitive reflexes that are unintegrated, and we're going to see all these things on our clinical exam. And then we're going to meet them where they are, use our tools to help bring more regulation.
I think that's so important. And for any of the providers out there, I had an experience recently where we were presented in a grand rounds situation on the stage, some different cases. And one of the cases happened to be a situation of a child who was on 7 concurrent SSRIs, 7. And to me, that screams fear. That screams fear on the behalf of that child's providers, where that provider didn't have the right tools in their toolbox, didn't know where else to refer. And unfortunately, it was so fearful of tapering this child off of the SSRIs that didn't work that they just kept adding more and more and more until this child is finally, completely, I mean, I hate to say it like this, but essentially a shell of a human being, like not even interacting or, I mean, they might as well just be a vegetable in a hospital at this point, because there was no quality of life, none. And so I do think it's really important as providers that when we have people, and this is just a side note, that when we have parents providing information like this and trusting us with information that is very deeply personal, and for a lot of parents, they've been shamed by other practitioners and things like that. So, it's a major, major issue. But when you see those cases, to approach them with at least some modicum of confidence, instead of, this fear-based, okay, well, there's nothing we can do other than just throw more meds at it. So I really love that you said that. And I think that that's hugely important and missing from a lot of practitioners, unfortunately, within this field. So
I agree with that 100%. And I think that goes to the original point of like, we have to, as providers, we have to be able to take recognize our egos in it and recognize our own kind of bias in this, and take a step back and be an investigator and say, not everybody who walks through my door, I cannot just have this, even if listen, everybody under my care, this is going to be good for them. Sure. I can help anybody who walks in. You can help anybody who walks in is going to benefit from something that you have to offer. Certainly. However, we still have a responsibility, and this is our main responsibility, to make the case for ourselves clinically, to say, I have to make the case. I need to, that's what I say to the doctors we train. I have to I can think, okay, I see what's going on here. And when you've been in practice a long time, someone can walk in the door and you can pretty much you're usually right on with what you're going to find in your exam, sometimes not, but you still have to do the exam. You still have to investigate. You still have to understand what's going on. You still have to listen to mom. Mom is diagnostic gold. She knows her kid better than you. Listen to her. Take your ego out of it, put the pieces together. And then the point here is you have to know more, and you have to know what else is out there so that you can say, instead of just putting a kid on 7 SSRIs because your ego is so in it that you can't possibly see, oh, there might be some other things that I'm not the expert in that could help this kid, because clearly this approach is not getting it done.
right.
And it doesn't mean also that you don't have anything to offer in that case, right? But I see it in every profession. I mean, I see it in our profession. I see it in even chiropractors, well-meaning, big-hearted, pediatric, great trained chiropractors sometimes, who are just so unwilling to just learn a little bit more about what's out there because they're afraid it's going to devalue what they have to offer. And that then they'll just keep their head down and go, I don't know, let me just keep doing this. Where you could go, let me keep doing this in addition to getting homeopathy on board or getting some of these other things on board, which is what's right for this patient.
Right. Yeah. And ultimately, I think that's what it comes down to. So anyway, my little aside here, my word to the wise when it comes to all the practitioners out there.
Love it.
Okay. So there's something that intrigues me personally, and perhaps this is another tangent, but so I personally have always had one pupil that dilates more than the other. Is that something that you would see as an early sign of some kind of a neurological disorder, or is that just a genetic thing? Or
it can be both. It can be an actual emergency. Is there, if that was a sudden onset of that happening, I would be sending to an ER to make sure there's not a tumor, a brain bleed, something going on. Right. But it also can be a genetic variant, which is rare, but can be there. And it also can just mean, just recently we had this case in one of our doctors, because we do clinical rounds together after they go through training. So their patient presented that way. I was like, get them checked. And they got them checked, everything. They went to, their GP, they went to neurologist, they went to a neuro-ophthalmologist, and they're like, nope, everything looks good. It's just the variation of what's going on with them. And it relates to their imbalance. This is the medical community saying it's their imbalance of their autonomic nervous system. Sure, of course, makes sense. We have to rule out any big scary things that might need to be addressed, with right now strategies, right? And so again, knowing more about that, and particularly if it's this sudden onset, and particularly if it's oh, I got hit in the head with a baseball, and then this happened, please go to an ER. But in that case, they're saying, oh yeah, this is just basically an asymmetry and imbalance in the autonomic nervous system, which again, well, yep, that's what we do. And so that's great that we know that, make sure we do our full assessment and then support that individual from the bottom up, nervous system up, to make sure we have balance, because that's going to impact, their brain. That's going to impact that's going to impact everything, because the nervous system is controlling everything. So.
Yeah, absolutely. So when it comes to working with different people, different populations, are you also working with whole families, or are you primarily focusing on the children? Because I know a lot of our listeners have children with some kind of developmental or neuroimmune type disorder. And yeah, a lot of times that stems from parents with autoimmunity or various other diagnoses. So maybe talk me through a little bit of that. Is there help that the parents can then derive from what you're doing with the kids?
Yes. We work with whole families, in multiple for different reasons and in different ways. Typically what happens is somebody comes to us because their child's having a challenge. And as we all know, as parents and working in this field, even if we have a challenge, the kid is going to come in first. Right. And then what usually happens is, as I say, my job is to help the parent develop a brain-based lens of understanding, to see their children in a whole apart kind of way. And as we're going through that, through our whole process of our clinical experience, our fourth pillar in our work, everyone thinks it's like the fluffy pillar. And I say it's the most important pillar, which is brain-based mentoring. We are educating and helping these parents and families develop their tools based on our knowledge and our learning of brain-based concepts, the why behind behaviors, the how behind connection and learning, and all of these things. While we're working our clinical solutions, we're helping them understand. And this is one of the things we hear from parents all the time, is like, nobody was telling me like, but why is my child having this challenge? And then what do I do? Right. And so that's a really big part of what I feel is very important as a clinician and as just a human being, is helping develop that for families, and, connection and engagement and healthy strategies based on that. And so that's how we work with families. And then in that sense. And then the other thing is it is most common that when one person in the family starts to come in, more times than not, the whole family starts to utilize us in a clinical sense as well, because they learn about, what we're doing and how it supports health. And then they have their own, like, well, I have these autoimmune challenges or neurology challenges or whatever. And then they get under care too. A lot of this presentation. And I'm sorry, dads, it's a little different presentation. Usually women, it's like late 30s, early 40s, maybe late 40s, moms who are having, I started to notice this about 3 years ago. And it's these moms that were bringing these kids in, when I take their history, because they're like, wait, I'm experiencing memory loss and attention issues, and I have a lower adaptability or tolerance for noises or stress, and I'm losing it. Like, I'm getting like emotionally dysregulated really quick. And I just like, don't know what to do. And I say, like, I started doing exams on these moms because they started going like, I'm having those challenges. I was like, well, let's do exams. And they started presenting. This is about 2019. I started to notice this very significant thing, which was their clinical exams looked just like my traumatic brain injured patients. And I was like, this chronic stress impacting the brain is presenting just like traumatic brain injured patients. And then starting that whole inflammatory cascade, which it's like the chicken or the egg, which one came first, it's different, depending on the person. But we then utilize the same strategies based on how they present as we would in their kids and or in traumatic brain injury patients. And we get results, and it's important.
Interesting. So if that is the case, do you think there's a potential for TBIs caused by chronic emotional stress?
What I've noticed, and I think is the case, and you're seeing this become talked about, and understood, is that under chronic stress, and whether it's chemical stress, so we have more inflammation, emotional stress triggering all of that, just stress in different forms, lowering the threshold for like the amount of impact. Let's say if you're talking about like a TBI, like in the physical sense, like the threshold is lowered. And so it's easier to get these multiple concussions, these traumatic brain injuries. So, because we're already in that inflammatory stress state. And so, like one patient I worked with, and she came to us, she was in her mid-20s, she had 16 concussions. And she was her talk about like, she presented more severe than most of the kids that I see. I mean, she was a high functioning, owns multiple businesses, like productive lady who would like just tank and like have to be under her desk and like have no light, and just would like crumble, and was just struggling in life, struggling with relationships, like struggling to do life. And she had gotten to the point where she had 16 concussions, but it wouldn't take, she just like, her dog like bumped her head slightly and she got another concussion and took her down this, and so it was just her threshold was so low that then it was just this repetitive cycle that was happening all the time. And so we did our exam. She presented more severe than most of the kids we see.
Yeah.
And she's doing amazing. She's graduated our work a couple years ago at this point and just doing amazing. But that's a perfect example of that.
Yeah, that's really interesting. I know, from my own experience, when I had genetics run, for example, my own genetics were actually looked much worse than my child's, but,
Yeah.
and I don't know if it could have been attributed to the fact that I grew up in a different era. So perhaps I wasn't seeing the onslaught of quite so many environmental toxins or things like that. But I certainly have had my own challenges with autoimmune symptoms and all kinds of other, really crazy types of things that doctors are baffled by. They don't understand.
Yeah.
So really interesting. Yeah. I think a lot of times, especially moms, we tend to ignore all of the lovely things that are going on with us. Until perhaps then we start thinking about our own kids and the symptoms that they're having and the ones that we also share.
Yep.
So
Yep.
very good. Well, Amy, so if somebody were wanting to work with you or with one of your doctors, where might they find you?
So my brick and mortar practice, as we call it, is in Coeur d'Alene, Idaho, and it's called Spoelstra Family Chiropractic. So and we have the Brain Blossom program there and the Focus program. And so that's our in-house brick and mortar practice. We do have people that travel to us to have exams and consultation and put together plans by me in person. But we also have doctors that we've trained and certified that offer the Brain Blossom program and will do this clinical approach. That if then they need help, they are going to pitch it up to me and we're going to discuss that together. So they have the clinical support if needed. And that would be, you can find that on brain-blossom.com, a list of those providers. And you can also find it on gofocusacademy.com. There's a list of certified providers offering the Brain Blossom program, certified providers, and one step up from that, the ones that have direct clinical connection with me and support and offering the Brain Blossom program, which is the brain and body exercise piece of that you would do at home in conjunction with their clinical care, which is designed by me. And I'm actually in it. It's like a little app and you will see me. So you'll be working with me. That's at gofocusacademy.com. And that's under the list of providers. So, we have Facebook and Instagram and all that stuff. Although I don't actually know how to use Instagram. I have team members that do and can pitch me up a question I'm not doing it.
You got enough on your plate, right?
Yeah,
lighten that load a little bit.
Yeah, exactly.
Awesome.
Yeah.
Well, thank you so much, Amy. I always like to ask our guests, do you have any last words for some of the parents who might be struggling out there, some of the people who might be struggling with autoimmune disease, some little nugget of wisdom that you might proffer for them?
Yes, I just feel like it's so critical and important for people to hear that. I know it feels like nobody understands and that you are alone and that there's no providers or community out there of people that can help you because you've been to person after person. And I just want you to know that you are not alone and you are not bad and you are not lazy and your kid is not bad and your kid is not broken. And I want people to have hope, even though I know it's very easy to feel hopeless in this scenario. I get it. And there are people out there, there are providers, there are people like Aaron, there are people like me, we're out there, and connect with those people and ask for help.
Thank you so much, Amy. It's been a pleasure. Thanks everybody for listening, and we'll see you next time. Take care.